Good evening, everybody, and welcome to another focus on Liberia. Dennis is unable to be with us today, so I'm stepping in. And with me today is family nurse practitioner Abby Tyler. Hi, Abby.
Hi, Jackie. How are you?
I'm fine, thanks. And Abby, we are joined with Abby Tyler, Healthy Living, who's collaborating with Focus on Liberia for a three-part series on healthy living and your body. So we're going to just jump right into it. Post your questions for Abby, and she will be able to get to it once we're done with ours that we have. But Abby, tell us a little bit about yourself before we jump into it, because I don't know Abby Tyler, and I'm sure there are some people who don't know. So how did you get into the health area?
I think I give a little bit about myself last week for
Okay.
those who don't know me at all yet. My name is Abby Tyler, formerly formal Abigail Tyler. I am a family nurse practitioner. I got into nursing, family nurse practitioner, and in the nursing field first because, like I wrote on my entry level when I went into my master's program, that when we were back home in Liberia, we didn't have primary care physicians. So, and if, especially if you were poor, we did, but if you were poor, you never saw, for annual physicals and all of that. We usually relied on my mom had a friend, Miss Rose, who was a nurse, who we went to for everything. And if it wasn't for her, all those little illnesses, cuts here and there, malaria, fever, and all that, if it wasn't for her, most of us won't be here today. So I always admired what she did. And I saw the desperate need that the healthcare was in Liberia, and even it is today. And I saw the Peace Corps, and I saw the missionaries that went there and helped out. And I always thought that I wanted to do that for myself and to be able to give back to my community. So I got in when I came here, went to school, when I was a nursing assistant first, and then I went and got my when I got my RN and which is my associate degree first, and I got my bachelor's from Immaculata University, and I got my master's from Drexel University. So now I'm a practicing family nurse practitioner, and I work in a private practice in Philadelphia. I am married and a mother of two.
Oh, okay. Boy and girl, boys, girls.
A boy and girl, yes.
Okay. Okay. So we'll jump right into it. Thank you for that. Yeah. For those who are just joining, I thought it was best to say a little bit about yourself. So let's get into the annual routine physical first. Why, Abby? Why is it important that we have a physical, and why yearly? Do we need to do it more frequently? Why is it important?
Right now, the guidelines call for yearly, but it can also be done more frequently based on when you see your doctor for the first time, and they do your examination, they do your routine blood work and everything, and they may see something. Your doctor and nurse practitioner, I'm going to go say provider and doctor interchangeably here. They may see something that you may have to come back, maybe every 3 months. You may have to come back every 6 months or so, every 4 months, so they can follow up. But right now, the guidelines by the CDC, United States Preventative Task Force, and all the other medical practitioners. They said come in once a year, and it's important because most diseases have no symptoms until it's too late or until it starts manifesting themselves. So things like high blood pressure, which we call hypertension, diabetes, and chronic kidney disease. Most people don't know that. Or if you have something going on with your eyes or anything, that any abnormality that you may just chalk up to that, oh, well, my foot's hurting me. Oh, I've been having my foot's been swelling, or this is a little discoloration of my foot. And you may just think that it's just something minor, and it could be something really major or a telltale sign to something that's even more major than what you think. So it's important that you come in every year. When you come in to see us, like I said, we actually about your history, and we actually about everything that's going on in your body, what we call review of systems. So we actually about everything that's going on, and then we do your physical exam that we do from head to toe, asking you questions in the meantime. So all those things are important, like I said, because most diseases don't manifest themselves till it's too late. So it's important that you come in to get checked every year, and we look at your blood work, and then develop a plan of care to keep you healthy.
So um, it's annually, but I'm sure there are specific tests for men, women, children. So let's start with the men first. What are some of the tests? Like, if, for example, somebody who doesn't know, they go to the general practitioner for an annual exam as a man? What are some of the tests that they will do on them, or that they should ask for?
For men, at a certain age, when they're much younger, at a certain age, it's basically the same as female. We go in there, we're gonna like I said, we do a head to toe assessment. We're gonna be asking if you have any headaches, any problems seeing. I don't want to go too much of a detail. Any chest pain, any palpitations, because chest pain, anything with cardiac related, manifests differently in men than they do in women. So usually they'll say, "No, I'm not having chest pain. Are you eating okay? How is your intimacy, your life, and are you when you urinate?" Most of the things, start looking at prostate issues early, especially for black men. When you're urinating, do you have a hard time urinating? It could also be urinary tract infection. Do you, when you finally urinate, do you feel like you emptied out completely? When your urine streams coming out, it's supposed to come out nice and straight. Is it coming out curved, or are you having issues with that? That could signal that some problems are going on with your prostate. And so, and doesn't mean prostate cancer. Some people having large prostate, and as men get older, they have issues with their prostate. So usually we'll check for that. We can, this prostate exam, I can do that can be done in a general practitioner office, in like an office where I work, primary care. Or if we see anything that's a little bit more detailed, we'll do your PSA level, and that alone, if it's enlarged, if it's elevated, doesn't mean that you have something going on. Usually we'll follow with the physical exam, and if we see anything, that we can put you on medication to kind of like control your prostate. But if we see anything, we'll do your urine test and all, and we see any kind of microscopic blood, anything there, that we'll do ultrasound and make sure that we'll follow you up with urologist, send you to a urologist to make sure there's not anything going on there with your prostate exam. And most especially if you have any family member with prostate issues, prostate we call BPH, benign prostatic hyperplasia, that can be controlled with medication. But if it gets to the point where there's something else going on, like I said, we start seeing UP in our blood, you start having severe pain, then we'll send you for an ultrasound and then follow with a urologist. But as usually men, as they get older, we start looking into that. But we, for men, it's usually most of their tests don't come till much later. And then also when they get to like age 45 to 50, ACS is trying to bring it down to 40. Now we also do colon cancer testing too. So there's two ways of doing that, which is for both male and women. If you don't have any family history of colon cancer, like a first degree relative, mother, father, siblings, we can tell you, we can do the test where you just take the package home. We call the company, and you put a little stool on a little container. You don't touch anything, and you send it to the company, and they would test it. And if there's, because what happens is when you have a bowel movement, the stool comes down and picks up the DNA coming down. So they test that, and if that is negative, they'll send the information to us first. We'll call you, say it's negative. You have to follow up in 3 years and follow up, unless if there's something else going on. If you start having bloody stools and later than that, and you can go ahead and, but it's good for 3 years. If you do have family members with family history of colon cancer, then you have to go for a colonoscopy. We'll send you to a GI doctor and you go for a colonoscopy. That is done you do it, you're cleared every 5 to 10 years. Some doctors say every 5 to 7 years.
And then for women, the annual exam for women, what are the
So for
specific tests?
For annual exam for women, usually when you come to us, like I said, we do the same physical examination. We're generally be checking full body to making sure everything is okay. Most family doctors don't take all your clothes off unless if there's a reason why. They'll tell you, okay, get completely undressed. You keep your underwear on. But we'll check your body and everything, listen for your heart. And sometimes women will say, I've been having, like a lot of reflux, or I feel something that's coming up here. When you're having reflux or indigestion, and also heart attack, they kind of mimic each other, the symptoms. And like I said, heart attack issues or cardiac issues kind of manifest differently in women. So we listen to all that. We say, okay, when you're eating, how long after that do you have these issues? Are you having any problems with your belly? Are you having any problems with your appetite? Are you having any problems feeling like too full, before you're supposed to be full? Are you having any problems like with urination? And also we look for all of that. But the main test, like when you get for children, women, when they get to age 21, is when you're supposed to have your first pap smear. So that's when you're supposed to go to your GYN. It used to be, prior to that, it used to be like, okay, when you start having sexual relations, or if there's any reason why you need to go. But now, even if you go prior to that, they won't do the whole full pap smear. This is when, for those who are going to have a pap smear before, you go in there and they do a full invasive testing and all. But they recommend it because a lot of people will go in there and say, oh my God, I feel something, I feel something, I feel something. And then they were going there and doing a lot of biopsies on the cervix, which is the inner part that connects to the uterus. And most people are having some issues maintaining pregnancy after that. So we're compromising the cervix a lot with every time people go in there, younger women saying that they were having issues. So you're supposed to have your first pap smear at age 21. and then HPV testing too, because HPV testing, they usually testing the cervical and all to make sure cervical cancer, to make sure you're not having any cervical cancer. And we also look at the whole female reproductive system, the outside part, to make sure nothing else is going on. We look for lesions, we look for discoloration, we look for any kind of issues that may signal also a signal abuse too. So we look at that, and we send your test, and if it's fine, most doctors still want you to come every year, or if they see something abnormal, they might say follow up in 3 months, follow up in 6 months. So right now it's recommended what every 3 years, every 3 to 5 years, but depending on who your GYN is, and depending on your own family history and your own personal history of what they found the first time, is every some doctors still prefer for you to come every year. So you have to discuss that with your family doctor, with your GYN, and GYN is a gynecologist, and OBGYN is, they both do the same thing. Some doctors don't do the OB part, they just do just the GYN part, and some doctors do both. And it's important for you to do that. Make sure that you're fine. And so when you do start getting to the point where you start having any children, and this, then the doctors can already have your history and everything in your profile. So if you do start having any issues later in that with your menstrual cycle, they already have that and it can work from there.
So
For women also, when you get to age 40, when you get to age 40, the same 40 to 45, it depends on your family history as well. That's when you're supposed to start getting your first mammogram. And October is breast cancer awareness month, and I did a whole show on breast cancer awareness. If anybody who sees, you're on watching the show now and you're on the same page, my video is below this. You can go in there, do your breast cancer. Is every year mammogram every year. Your screening mammogram is every year. If you have family history, they're gonna, go there a little deeper into testing, do further testing besides just the screening mammogram. So they do that every year. If you're negative, fine. If you're not, and you're supposed to be doing your breast exam every year. Also, like I said, I went into detail with that in my other video there, so you can just take a look at that. And also at that age too, we start looking for colon cancer. With men, we do the same thing, colon cancer. If you don't have any family history, you get to 45, 50, we start talking about menopause, menopausal symptoms. Prior to this, we're all going to be talking about birth control, contraception. Some people don't want to try, and there's so many different methods. We tell you, making sure you're talking to your GYN and getting different options on what to do. But around 50, we start doing the menopause and start telling you where to go from there, how to approach menopause, how the different symptoms, and how to report that to your doctor. Get into 60, we start talking about osteoporosis. If you're very thin frame, even before that, we all do Dexa scan to make sure your bones not going to break as you get older, because that's why women, when you're not making too much the calcium and everything that your body doesn't have before, like when you had in and vitamin D, when you have prior to menopause, your body doesn't make that anymore. It doesn't make it as well. So we want to make sure that we're getting vitamin supplements. You're doing your DEXA scan to make sure that you're not going to break your bone and become disabled from there. And we go on later on from there.
wow, thank you. So Abby, I want to deviate a little from the questions to say,
Oh, sure.
let's say a man in Liberia with the challenging healthcare system in Liberia. Let's say a man goes to urinate and he feels like, oh, the stream is coming, is not coming forcefully, right? What should he do? Are there foods that he can eat? What are some of the things that he can do if he cannot get to a doctor for treatment right away?
The first thing when Doug, if he comes to see me, I'm going to ask him, are you drinking enough? Are you drinking enough fluid? Because you want to make
Water,
sure the
okay.
more fluid that you're taking in, and that means you're going to be putting out enough fluid to have a regular urine system. And also,
But
are
not
you
beer, not beer. You're talking about
not
water
beer.
now.
Usually water, non-carbonated drinks. If you drink a lot of soda and things like that, we tell you to stay away from it. Not beer, not hard liquor, and things like. Some people, I mean, if you're drinking occasionally and lightly occasionally, because there are some people who say, "Oh yeah, I just do it occasionally," and they drink a whole lot on the weekend. So, and that's not good for your liver either. So I will ask them first: are you drinking enough fluids? What at what time are you waking up at night, peeing very frequently, and then burning sensation? I would try to do the fluid, and then I would do a urine and CNS, but then I won't be there. I'm talking about Liberia now, right? So I'm not too aware of too many foods that
So,
you can
so
eat,
I
because I
think
have to do a physical examination on you first to make sure that nothing else is going on that's causing that. Are you having issues? Are you having any urinary tract infection? Are you having any issues with your heart? So there's a whole thing I'm going to ask about. But most important thing is make sure you drink a lot of fluid. Sometimes the cranberry juice, kind of washes it out. But it, like I said, when it comes to certain things, certain diseases, there are symptoms that mimic certain diseases. So I'm going to have to go through the whole list of, okay, is it urinary tract infection? You having a burning sensation? Are you also having unprotected sex? Could they be you having some STD or something going on? And then we'll follow up with the physical examination. But I will first go on with the fluids first and see how long it's been happening. Drink a lot of fluid, and when you start, especially looking at your age as a Black man, it's kind of hard to really put myself in a position in Liberia where I can say do this, because I don't know too much about what they have over there, and I try not to speculate too much. But mostly drink a lot of food, eat healthy, cut back on alcohol. If you do a lot of alcohol, cut back on alcohol, non-carbonated drinks, and all that, going from there. But you probably need to see a family doctor that's going to have to do a physical examination on you, and then do some blood work to see how to help that.
Yeah, I think that what I'm trying to do with the questions is just people who are back home who don't have access and they want to know. For example, I used to drink a lot of carbonated water, flavored water. And my doctor said, just drink water. Don't drink carbonated water or
That's
flavored
water.
water. Yeah, now I drink water. Okay, so for the man, maybe cut back on the beer, maybe drink water and see if his urine flow would increase
Yes,
or
if
would be
there's no,
okay.
I'm also going to ask you so that, if you drink a lot of, yeah, drink a lot of water, that should help it. Because I
Yeah.
mean, and I also want to put a caveat too, because if you have those who with like chronic kidney disease or any kind of heart issues that say you're not supposed to drink a lot of water, when I give advice as an NP, or even when I was a nurse and all that too, there's so many different things that I have to say, but, as opposed to just somebody who's like totally healthy and say, drink a lot of water. But the first thing we do is drink a lot of water. If I don't know anything about you, I'll say, drink a lot of water. See, is there any odor? Are you having any issues? Is it painful? If it starts getting painful for you to pee, then it could be like a BPH. It could be a urinary tract infection. Are you having unprotected sex? Are you being monogamous? And things like that, or you wearing protection when you're not being monogamous. All those things we have to like rule out first before we can say that. But water, drink a lot of water, eat healthy. Yeah.
And even I remember back home they used to say that to test for diabetes if people pee and they see ants going there because ants are attracted to the sugar. It means you're drinking, or you're intaking too much sugar. Those are some of the things, the indigenous ways that people kind of like, oh, I think I'm supposed to cut back on my sugar and things like that. So let's say, for example, talking about women, like young women who would like to, who don't go to the doctor but would like to do breast exams, right? So how do they do it? They raise their hand. How do they do the breast exam for a young girl?
Alrighty. Like I said, I did that video before that, but I'll go in a little bit into it
Oh, I'm
more.
sorry. Okay, so is it on
No,
your
no, that's
website?
okay. I do, because this is a lot more people will be watching this, so I don't have any problem with that. But
Okay.
when younger too, because we do this. Before I add to this, there's some Liberian. She was my classmate back home. Her name is May Makamo. She
Okay.
had aggressive breast cancer at a very young age, and this is not something I'm breaking any news or putting her business out there. She put it out there. She has a foundation organization called Tiger Lily. So anybody wants to go into that can look into it and see. She did a lot, and she did a lot of publicity, did a lot of things. She even donated a mammogram machine to JFK way back in the day too, and apparently it got misplaced. I don't know. But anyways, that's beside here. But just look up her story too, because she was very young. So you're never too young to get breast cancer, because the younger you are, the prognosis is poor, like I said last time, because you're still seeing your period and your body works on your hormones. So when you do get it when at a young age, you want to make sure you do that. So when you are going to be doing your breast examination, doing it every month, make sure you're doing that like a week after your period. Don't do it prior to, or don't do it during, because your body is like full of hormones when you're on your period, and your breasts are naturally engorged when you're on your period. So don't do that. You may feel something that's totally not there. So you want to make sure like a week after your period, when you have to do it, you put your arm completely behind. And I tell people, because all back here under your arm, that's all your lymph nodes, that's all kind of breast tissue too. So you're not just doing it here, you're doing it all below there. And you want to start from the very over here, and you're doing like 2 fingers, 2 or 3 fingers, because you want to feel it. It's going, if you do feel a lump, it's going to feel like a frozen P, not the letter P, but P or kittle, like how we used to call it, call kittle. My kids call it American kittle. And so you just do that, and you do finger, and you go clockwise, you go all the way around, you go all the way around, and you're pressing hard because you want to be able to feel it. Okay, because you have to feel it in the back, and it's sometimes very tiny. You won't be able to feel it anyways. So you go all the way, and then you come all the way over here. When you get to your nipple, you want to squeeze. There shouldn't be any drainage coming from the nipple at all at any time, unless if you're breastfeeding. So even when you're doing that too, when you're breastfeeding, that's different. There shouldn't be any drainage. There shouldn't be no white drainage. There shouldn't be any bloody drainage, especially not bloody drainage coming out. And you also go on your arm and do all that, touch that too, very, and do that every month. Do the same thing. You do the same thing, and do that yourself or somebody who knows how to do it. Begin, don't do your partner, like I said, because you're not gonna be really paying attention to what you're doing. And do that every month, a month after your period. If you feel anything, you want to make, and if you say, oh, wait a second, I feel something there, it shouldn't be painful, because if it's painful, something that could be just a cyst, it could be a painful cyst, other growths that go on in the breast, that's not necessarily cancer. So if you feel it, some people get afraid and say, oh my God, I don't want to check it, I don't want to go check it, it could be cancer. Don't do that. Please don't hesitate, because it could be something else, it could be cancer, and you don't want to sit there, I'm just going to wait. You can pray and all that. I tell people, go ahead and pray, but make sure you tell your doctor and say, I felt something, can you please do it, and we'll do it again. And then also follow up, because the mammogram is the most, like, this is the one that we did, the guide that we go by first. So we send you to go get your mammogram, and go on from there. And we never dismiss like a young person, because like I said, you can still get it when you're young. I had like a couple of coworkers that were like, younger than 40 and had breast cancer. So you're never too young to get it. So it's important that you start teaching your daughters, your and girls, and the people in your family, making sure that you do your breast exam every month, a week after your period, and do a thorough exam with your fingers, not massaging fingers, so you can feel it.
Wow. Yeah, thank you. And speaking of young girls, one of the things that we noticed this trend is wearing leggings, right? Tight leggings. Everybody's wearing leggings, and I want to bring it because I read something the other day that the tighter the leggings, right? And if the leggings are not made of breathable fabric, like say polyester or plastic that holds the body, right? That a lot of times these leggings tend to give young people who wear them, not only young girls, urinary tract infection, because there's no air circulating where it should be circulating. And I would like to know, is that true? What I read about urinary tract infections in leggings?
Well, anything that's too tight against the vaginal area, you're not getting enough in the urethra, which is the female opening and all that, and then the urine opening. If you're not getting letting enough air of that area, that's going, because the area is always moist, and it needs to breathe. You need to put out air and all that, need to breathe. If you're not putting enough air there, if there's not enough air going there, of course you're going to get urinary tract infection, and you're going to get yeast infection too. So if you're wearing leggings, I would say make sure that, and also you're supposed to be wearing panties, even if you're wearing designer panties, the seat of the panties should always be cotton. So you want to make sure you get something. And
Yeah.
some people like to wear the thongs and all. Sometimes the thongs kind of is right up against your skin. So if you're gonna wear that, don't wear it all day. And as soon as you get home, take it off. Wear your boxers. They have female boxers. You can wear like a nightgown where you're allowing yourself to, allowing the air to breathe. And urinary tract infection for young girls is very common also for older women too, because younger girls are still learning the bodies. So, and the opening, the vaginal opening and the urethra, like so right next to each other. So it's easy for germs to go from front to back. So making sure when you go to the bathroom, you're wiping from front to back, which is from, clean to dirty, not wiping backwards, because that way you're going to introduce, yeah, and also make sure you're drinking a lot of fluids too, drinking a lot of fluids. And like I said, make sure whatever you're wearing is not too constricting, and you're not wearing it for a long period of time, and not wearing it every day to where you're going to be causing any kind of urinary tract infection or yeast infection.
Yeah, that's good information. I read it. I was like, oh, okay. So moving on now from the young people to the elderly, you talk about osteoporosis, you talk about menopause and things like that. I know one of the things that one of my aunts used to say was that she was eating tofu because of menopause. So walk us a little bit through menopause with the hot flashes. What should people be eating? What should they avoid? And what are some of the problems associated with menopause?
Well, you want to, for menopause, you
And
want to make
do
sure,
men
because
get do men get
people
menopause?
say that again.
I said, do men get menopause?
They go to a change of life. Their testosterone
Okay.
level kind of drops. It drops a
Okay.
little bit. Of course, they got 10,000 things that can help men with their testosterone level and all that. So, but unfortunately, like my friend used to say, God's got to be a man because women go through from birth to like, and they got so many things going on with them. So for menopause, like most people, it's talking perimenopause, so we call that like around age 45. And so, and people, you start seeing period less and less. And some people go through, you don't start going through it much later. But menopause is 12 consecutive months of no period. So let's say if you were, 45, 50 years, 50, 48, and you didn't see a period for 3 months, you'd be like, oh, okay, good, I'm going to, and then you have, then unprotected sex, or, yeah, and next thing you know, you could be pregnant. And that's not saying when you have it, you're pregnant that late. So 12 consecutive months. So if you come to me and I tell you, oh, so when's the last time you saw your period? And they're like, oh, okay. And I said, did you see it in between there? And then you didn't see it again? Yeah. So you're not menopause yet. So you're perimenopausal. Okay. So when you do get to menopause, usually by then you would have, that of course we start talking about we
One
start
year,
talking,
1 year without.
yes, one complete 12 consecutive month. We're going to do
Okay.
12 consecutive months. It can be in between 12 consecutive months. And you want to make sure when you get to that point, you start having hot flashes. Usually the stress level is different. One minute you're hot, one minute you're cold. There's up there. And that's when you also want to make sure you're following up with the GYN too. There's many medications, topical ones where you can apply to your body where it kind of helps. And there's so many natural ones. So I always like to go the natural route first. So natural ones, your GYN can have a conversation with you. But for some women, the hot flashes are so bothersome. Your mouth is dry. You feel like you're gonna fall. You're gonna jump out of your chest. You're having chest pain and things like that. The different, and some people have problems concentrating, and so many different things that go on. Hair loss, and it sounds horrible, but it's like just it doesn't happen to everybody, but that's like the average. So usually you talk to your GYN and have different options, and it can give you medication to help with the menopause. But usually they tell you what is called hormonal replacement, and usually they tell you for 3 to 5 years. So most of the time it's like 3 years or so, because the side effects of that can also affect, like, contribute to breast cancer and other issues as well. So as much as you can, they'll tell you go online, look for natural remedies, work on your stress level. If you know you're going to be doing something that's going to cause you to get too frustrated very easily, take your time, work before it longer. And then also when you get to menopause, you have to be on like calcium and vitamin D, because again, your body is no longer producing it as much as it did prior to, and you don't want any kind of bone product. That's when we start running into bone health. And then when you get to age 65, we start going for the Dexa scan. When you do your Dexa scan, which is the bone scan, it measures your level of where you are, and it'll tell you the different levels. None, the osteopenia, meaning before osteoporosis, where we start giving you different medications. Your osteoporosis, then we put you on medications where it called bisphosphonate. Those two you take it for 3 to 5 years to kind of protect you, because for women, you're dealing with being older with your children, and most women are still caregivers in their homes. So God forbid if you fall and you break your hip, you're going to be disabled. And most of the times when women get older and they break their hip, that and it ends them, they become disabled, or some of them have to be in a nursing home because they're so injured. You can have a head injury and so many other things. So usually when the woman is very thin, thin frame women too, but sometimes it's like also women who have had different orthopedic issues prior to, but mostly thin frame women. Doesn't mean it can happen to you if you're heavy, because if you fall to, if you're heavy, you can still break something. But mostly thin frame women would do like a DEXA scan. But after that, but menopause, we stop with the calcium and vitamin D to make sure, and then we do some other blood work to see where you are, and then we have to add any more medications. We do that, but we always try with like natural remedies first before we start doing other the medications, because they come with a lot of side effects too.
Because they say that for menopause, some of the food you have to eat will be uh, what is it? Tofu, fruits and vegetables.
Well, you're supposed to be doing
You
fruits and vegetables all through. And even
all
when you're
through, yeah.
younger, even as a younger woman, especially going into childbirth years, you want to be taking
Yes.
you want to be drinking a lot of fluid, anything would have a lot of calcium, so a lot of milk, a glass of milk a day, and exercise. Even when you get to menopause, you're still supposed to be doing some exercise and walking and all that, because that strengthens the bones as well. It will add to a little bit of bone growth, not as much, but it's strengthening your bones, so that way, if God forbid, if anything should happen, you're not going to just break apart.
Like iron, right? Like they used to say, you should eat a lot of liver, because liver have iron. What other things besides potato grains and liver? What other things people should eat to have to get iron? Especially women. Women need iron.
I think you said I don't know, mostly grains like grains and all that. You want to do that, but then that also depends on. That's the thing when you talk about this. Where that depends on if you're not on any medication, any kind of blood thinner that requires you not to eat too much green stuff. Like if you were taking warfarin, like what the other name is Coumadin, you want to make sure. But a lot of grain, like potato grains, a lot of green stuff. You can take iron supplement too. There's iron supplement you can take that if you don't get the full amount in your, but also based on that too, when we do your blood work, we will see what your iron, where your iron level is. And most of the time, you can be taking, we'll put you on an iron supplement like once a day. You just take it once a day, and you take multivitamin. Like they had the multivitamin for women who are like age 50 and above, so they have mostly calcium, most of the minerals and everything in there that for that age group that they should be taking. So the other supplements in there, you can just take like multivitamin with iron, multivitamin with vitamin D, calcium with vitamin D, and things like that. But eat a lot, drink a lot of milk still, eat a lot of food high in iron. And I tell patients like you can go online, but then when you make sure you discuss that with your family doctor too. So because they're like you could have other issues that could tell you that could say don't eat too much of this, eat less of this, and all that. So I try not to give exact information. You notice I'm being very guarded because my word carry a lot of weight. So they'll be like, oh, I need to do my disclaimer. Everything I say here is, please make sure you can go to your doctor or your provider and say, oh, this lady was on Facebook and she said I should do this, I should do that at this age. Discuss that with them. Okay, but don't stop or commence any treatment without talking to your provider first, please.
Yes, you guys hear that? Okay, okay. So let's come down to diabetes, right? Oh, diabetes. We love rice in Liberia, and I know that rice is the number one culprit. I mean, now I eat buckwheat. I eat buckwheat. I eat couscous because my doctor said that the worst thing for diabetes is rice. Tell us why, without any caveat, tell us why rice is bad for us in Liberia as we eat it, and tell us the connection between rice and diabetes.
Carbohydrates. It's got a lot of
Okay.
starch. It's got a lot of carbohydrates, and it's not just Liberians that eat rice or Africans. You have because I say that to my Asian patients. I say that to my Hispanic patients because they eat rice a lot too. So anybody that eats food, and then you're also talking about pasta. So it's not just rice. They're talking about pasta. People who
Oh,
eat a lot of pasta,
oh,
a lot of mashed potatoes. So all of that is like, and for our Liberian people, some of us we we don't just eat cute little rice in a small plate. It's like a
yeah,
whole bowl, and some people
yeah,
eat it for breakfast, lunch, and dinner. Then
yes,
also, it's not just the rice, the kind of soup that we put on there. So we eat a lot, and then we put like I always say over and over, we put every meat in the zoo, we put it in the pot. Your pea feed, your boonie. Boonie is good. Fish is good, but we put turkey, we put big. I mean, I've seen some food where it's like, whoa, that's a lot, but it make the food taste good, but it's not healthy for you, especially as you start getting older. So rice and pasta and things like that they have a lot of carbohydrates, which also can store into body as sugar and another glucose. And also we tell you to cut back. When I tell my patients, I say I'm looking at your A1C, which is the number that we measure for your to tell you whether you have diabetes or pre-diabetic. Your A1C, we look at your fasting glucose too when we do your A1C, and I'll look at it and I say, okay, yeah, you're pre-diabetic, you're like 5.6 and above, you're pre-diabetic to like 6.4. So it's like, okay, this is where you are right now. You supposed to be put on medication but we're not going to do that right now. If you can work on, because the thing about type 2 diabetes, the good thing about it, you can work your way back from it. You don't have to be diabetic
yeah,
forever. So we'll tell you this is what you have to do. This is what you have to, you have to eat this. You have to watch. You can eat rice. We'll tell people, my patients tell me, don't even tell me not to eat rice. So we know that that's your staple. You're never going to stop eating that. So we say, watch your portion. You don't have to eat
yes,
rice
yes,
every day. You don't have to eat a large amount every day. And wash your portion, whatever you're putting on the food, to wash the kind of soup that you put in the food. You don't have to eat everything that's in the pot. And you don't, and you, if you don't cook it, that means you won't eat it. So in one side, start talking about diabetes. If there's one family member, everybody has to act like they're diabetic, diabetic in the household, because that's the only way one person would be able to succeed. And once you have a genetic relationship to that person, you know that's a high risk of you getting it too. So cut back on your rice, cut back on your salt, cut back on, because all of that kind of goes with the kidneys and blood pressure issues. Cut back, eat a lot of fruits and vegetables, eat brown rice if you can. I think there's something called diabetic rice too. You can eat diabetic rice. Couscous is good because it doesn't have that heavy starch in there. Wheat bread. Like I say, if you can't eat brown rice, eat wheat bread. If you eat bread, pasta, wheat pasta. So whatever you can do, yeah, there's something that's absolutely you like. I absolutely cannot do that. I'm try. I cannot do it. Don't do that much, and don't eat late at night either. Like if you're going to
Yep.
bed at 10 o'clock, don't eat around 8 o'clock. Eat around 6, and eat a healthy snack closer to your bedtime. Because when you eat that heavy, especially those of us who eat come late from work or other reasons, and you eat that heavy, your body, you're not getting up to move around. You're going straight to sleep after that. You're going to sit up for a little bit and go to sleep. And then your body doesn't have enough time to burn up all that starch you just took in. So it's good to eat early, eat like this. So eat like you eat your breakfast like a king, and then eat your dinner as a pauper. So eat your heaviest meal early on in the day, and then eat your lightest meal later on. So that way your body's not storing all of that and just adding on into your bloodstream and all that, because cholesterol level to your cholesterol, all that leads to high cholesterol, also contributes to diabetes as well. So most of the time people who have like diabetes also have high cholesterol. Then you're talking about kidney disease and then your heart disease, and also it's all encompassing. So you want to make sure that cut back on your rice, cut back on your portion, cut back on the kind of soup that you're putting on there, and exercise, because at least that way your body's
It's
burning.
yeah, the lifestyle. Because when I mean I'm pre-diabetic, and then when I went, he's like, "You are 6. You're going to." And he said, "I'm going to put you on medication." And I said to him, and my doctor doesn't like medication, and I said, "Tell me what to do." And I used to eat late at night. I would sit at the computer all day just eating rice. And all of a sudden, Abby, I went to buckwheat, couscous, brown rice. I would steam. I bought an air fryer, so I would steam my food instead of frying it. And then don't buy soda, because if the soda is in the house, you're tempted to drink it. I just bought water, and then I would, when I eat, I would walk around my office. And even when I'm going to work, I would park very far and walk. The difference is phenomenal.
Oh
you
yes,
know
yes,
yes.
yes.
And that's not to say you can't eat rice. You want to eat your white rice once a week, you can, but the portion, some people eat until they can't move.
Hmm.
And that is not good. You have to. And wheat bread, don't buy white bread. Wheat bread is very, very good.
Yes,
Yeah.
yes,
Yeah,
and like I
yeah.
said,
So
there's
water.
certain things if you can do this one, substitute another thing. If I'm gonna eat my bread today, then I guess you're gonna have to add another 10 minutes to your walk, right? You got to, just
Yes.
if you lift iron, you're gonna do extra 15 minutes, right? So you want to make sure your body's like, okay, less intake, more output. So you do that, and after a while, even with the white rice too, I say you can mix it up with the brown rice and mix it up like 20-75 white rice, 25 brown rice. After a while, you start mixing it in, and your body wouldn't even know the difference. And
Yeah.
your body gets used to it and all that. Every once in a while, you treat yourself, but you want to make sure that this become. I would tell people it's not a diet; it's a lifestyle change, dietary
Yeah.
modification, lifestyle change, and all that. So you know that you said, no, this is what I'm doing now. Oh, I'm not, because once you said diet or you have to do this, people like kind of naturally they're kind of clamped in. Oh my God, my body, I can't. No, 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 I can't do that. So no, you don't have to do it. You don't. Take your time and do it gradually until your body gets used to it. And you see what I tell people, these are the numbers that we're looking at. Okay. This is a starting point. This is telling you you took a test. All right. And this is where you are. If you don't improve what you're doing, then we're gonna have to move on to medication. Sometimes it's not your fault because you have it in your genes and you've done everything to prevent it, to delay it, and it still happens. And it's not like a failure to you. But if you know that most of it is your lifestyle, do as much as you can to control it.
Yeah, it's true. Because if you don't, my doctor said, if I gave you medicine now, there may come a time the medicine wouldn't work. Then what? So you
and
don't
and
want
with
to get on the
and with
medicine.
diabetes, I tell people diabetes, you also, because when people who are diabetic, we send them to see the eye doctor because it's one of the number one causes of blindness. So they have to see
Yes.
the eye doctor every year, or if the doctor sees them and see there are other reasons, they want to make sure to go back as frequently as the doctor tells them to come back. Also send them to the podiatrist, because usually when you have diabetes, you start losing the circulation and the sensation in your feet. So for a normal person who's walking around, if they hit their foot and they get a little cut there, it heals up. pretty quickly. If you're diabetic, you don't have that sensation, you don't feel it, and the blood supply is not going back and forth, going back and forth. So what happens is that little cut there, where like by the time you notice it, it has gotten a little bigger, and when there's no circulation there, and last which called diabetic neuropathy, after a while you start having issues there, and diabetes is the number one cause of non-traumatic amputation. That's how people end up losing, like, before you know it, they will start taking up one toe, take out the next toe, take out the next toe, and then before you know it, they have to take out one part of the foot, and then they lose like most of their leg. So it's always diabetes. I tell people diabetes is a really expensive disease, so you want to make sure that you try as much as possible not to get it, or delay as much as possible. And if you do get it, you want to make sure you don't progress to it. You don't progress to the complications part. There are times you're going to become complicated, but you want to make sure that you do that so you don't run into all this. And it also leads to kidney disease too. So you don't want to end up on dialysis and so many other things that arise after, because of diabetes. So you can really control it. It's one of the diseases that you can really control as much as you can. You can control it.
Yes. Oh, so many things can get wrong with this body. Okay.
That is,
So,
so that, like I
so
said, don't stress over it. Just do as much as you can, because I had, even when it comes to breast cancer, I had this story where Rosie O'Donnell, she was, anybody knows her, she was her mother died of breast cancer at a very young age, and she and her siblings were very young, and the mother died. So she always thought, I think around age 50, she always like waited around. She always had in the back of her head, oh my God, I'm going to get breast cancer at age 50. And she lived her life in so much fear up until when she got to 50, and she did her, doing her mammogram all through. And when she got to 50, and it's like, no, you still don't have breast cancer. She goes, now what? What do I do? It's almost like a rebooting of the mind. So even though you have this in the family history, you can do as much as you can to prevent it and all that. So that's why I tell people, try to do as much as you can to prevent it. You're not going to be able to control everything, and don't go crazy trying to control everything, because then that's just going to make you even more crazy. So do as best as you can, and do it. And when you do have a disease process, when the doctor tells you you do have a disease process, do even more than a normal person to make sure you keep yourself healthy.
yeah, no, no, don't be eating rice until you can get up from the chair. Don't be eating meat until you can't.
Fufu,
Okay,
fufu also, fufu
yeah,
will make that's heavy starch,
yeah,
and that
fufu.
just
Don't
sits
have a
there
dumb
too.
boy. Which is healthier, fufu or dumb boy?
And they're both from cassava.
Oh, okay, yeah. So
Yeah,
both
they're both
are
from
bad
cassava.
for
I think
you.
they have different kind of, they have so many different kinds now in America when we buy it and all that. But even if you eat the fufu, it shouldn't be like an everyday thing too. It's the same way, like I mean, eat a little bit, and if you're gonna eat fufu and rice, eat a little bit of fufu before you eat a little bit of rice, not
Yeah,
too much of both, because that's
not too much
And
of
I know
both.
sometimes when
Yeah,
people eat fufu, they're like, oh, I feel like didn't really eat at all, because you swallow it and it's like, oh, I didn't feel like rice while you chewing it and you enjoying it. So eat a little bit, let it be like an appetizer, a little bit of it, and then you eat the rice, and then some of the rice, and not make it too late. So
okay, let's move from that side to the eyes. Let's go talk a little bit about vision, right? Some people have glaucoma, some people have, what is it called, stigmatism. Some people
astigmatism, they have
have,
macular degeneration
yeah.
and
So,
all that.
so now, how often do we go to the doctor? And tell me, because I was arguing the other time with my daughter, she wanted glasses, right? She went to an optician, and I kept saying to her, because my daughter has pressure building in her eyes, and I said, you don't need an optician, you need an ophthalmologist. And she said, oh, it's the same thing. No, it's not. So first tell us how often we should have eye exam, and then tell us what's the difference between an ophthalmologist and an optician and an optometrist. Okay, uh-huh.
Well, you're supposed to see the eye doctor every year if
Okay,
you're
so the
diabetic.
eye doctor is the ophthalmologist.
You can see an optometrist. If you don't have any
Okay,
other eye issue, optometrist, you can see optometrist, like you go and get your eyes checked, they do the pressure, they do everything, and when they pop that thing in your eyes, a little more detailed than what we do in the primary care. You're supposed to see them every year, and they look at your vision and see, making sure what your prescription is for glasses if you need glasses. So they do all that. They do minor surgery. The ophthalmologist does more surgery, more, they do the same thing, but they can do surgery. Like if you have to have yes, a cataract surgery or anything with glaucoma or something advanced eye disease, you see the ophthalmologist. for that. So the optometrist does up to that point, up to and into surgery. They do like minor surgery, like I said, but the ophthalmologist is the one that does more detail. So we usually send our diabetic patients when they have advanced eye disease, if you have macular degeneration and anything else is going on, pressure in the eye, or sometimes you can have issues that going on, neurological issues that is affecting the eyes and all that. The ophthalmologist can take care of that. So the optometrist will tell you to see you and say, we see everything going on there. We want you to follow with the ophthalmologist to at least, to get like a baseline evaluation and see, so they can send you there if they see if there's anything going on. So for more detail and surgical eye thing, the ophthalmologist takes care of that. But you can go to see an optometrist for that. For glaucoma pressure in the eyes, the optometrist will probably send you to go in and look at your medical history and everything else. They'll probably send you to an ophthalmologist. But once a
Okay,
year,
so
once a year, everybody
once
needs
a
to get
once a
it checked
year,
once a year. And they tell you
once a year.
come back in 6 months or come back in 3 months because we see something that's concerning. Make sure you follow up, but at least once a year.
Okay, so if I can see an ophthalmologist or optometrist or optometrist or the optician, let's say, and I'm back home, let's say, um, how can I keep my eyes healthy? What are there
Um,
foods I can eat? What should I
you
do to keep my
you
eyes healthy?
look online, eat a lot of food with vitamin A, like because carrots and things like that. You can eat carrots. I'm not sure we have carrots back home, right?
Well, I don't. What if we not have carrots? What do like potato greens?
All of that. But once you're eating a balanced diet, put it that way. Once you're eating a balanced diet, then you're getting all the minerals and everything to survive because you don't really need supplements and all that. Some people take supplements because they want to, and all. But once you're eating a balanced diet, you're eating rice, where you got your proteins, you got your calcium. Once you're eating a balanced diet, you're drinking enough water, exercising, all of that, keeping that. But there are other things, even with the eye vision, all that. There are other things, even if you're eating a balanced diet, that the optometrist or ophthalmologist can see with their kind of testing that they do that look deep into your eyes, and that you won't be able to know what's going on until it's too late. So even if you're eating a healthy diet, there are diseases of the eye that you still need to get checked. I'm trying not to talk too much about how the Liberian setting because I'm limited to and perform practicing medicine the way I'm taught here. So
Okay,
without
one
having
of the
that,
things
yeah.
one of the
So
things I mean, going home is for me was the eye strain, right? Because the wattage was very low. Actually, I was driving and I was like, oh, I need to get my eyes checked because I didn't realize that the lights, the wattage were low. And so
mm,
I was really straining when I was driving. So all of those things also cause they cause eye problems, right? Eye strain and
yes,
things like
yes,
that.
yes. They try,
Yeah,
that's why they tell you take a break from maybe looking at the computer for like an hour or
yeah,
so. Take a break and don't. And some people take a break from the computer and then they get on the phone, they get on
yes,
the iPad,
yes.
and it's like no, 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 no. Just take a break. Take a break, move. And it's sometimes impossible to do that, especially when you have most of our jobs now require you looking at the computer like most at least 8 hours a day. But just take a break. Take your glasses off. You can keep it on. Take a break and just screen time, even for little, it's important now, even for the little kids, because most of the kids are being raised now basically when they misbehave or when they need to be kept quiet. We give them the computer, we give them the phone, we give them the iPad. So they're growing up with all that eye strain from a very early age, as opposed to us who are older and we started much later in life.
Mhm.
But so that's very important. It's like take away all that and just at least give yourself at least an hour in between. If you have to be on it most of the day, give yourself at least 30 minutes, 5 to 10 minutes in between, that you're not looking at any computer screen, that you're not looking at the phone at all. Even looking at the phone, like they hold their head down like this and they're looking straight down, you're the strain directly from that. They tell you also that can cause a lot of headaches too. So there's still so many studies that are going on in relationship with that. Some people even with like give you low motion sickness too, because when you go in like this all day, your eyes like trying to catch up with the muscles, and also you want to make sure you give yourself time, even with little kids, like I said, give yourself time, just shut everything down, give yourself 5 to 10 minutes if you can, and just take your eyes away from the screen, and then of course follow up with your family doctor if you have any issues with that. You start having headaches, it could be just your eyes and all. And if they give you glasses, don't, they say your prescription is good for 1 year, go back the following year and get your glasses. Even though sometimes we're like, oh yeah, but I want you my money, man. Try hard. So no, because you're over a period of time, especially the fact that we're looking at a computer all the time and phone and everything. that can also, you can wear your prescription out. So you need to go ahead and get a new prescription every year, like you're supposed to. I'm supposed to
Yeah,
have my glasses on right now, so if I have to read anything, I'm gonna have to. So
and sometimes it is best if you lower the glare, because sometimes your phone is so bright, but you can make it less bright, but
yes,
in the
yes, and I think
settings. Yeah,
yeah, on the computer too. I think there's like you can make it like a background at night, so you can make it away. And I think there's something called blue screen, low covering
yeah,
right now, so you can put it on the computer, and that way, so
yeah.
you're not getting all of that right in your face. So you can do that too. You can talk to right online, look online and see it, and go ahead and put that on. Like I said, do all that, and but also make sure you're giving your eyes time to rest, so you're not just constantly all that going in is going to your brains and your eye muscles and everything. All of that's interwoven there. So you want to make sure that you take care of your eyes because, you know, your eyes are like the most one of the major things in your body there. So your total independence. So
Yeah. So before we go to our tea, with the grinding teeth and everything, let's look at some comments and see what people are saying. Paul Poto say he's watching. Well, hello, Paul. Sonia says she's watching as well. And Sony say, I'm taking notes. This is a free doctor visit. Most of us pay money to get this very useful information, and I'm getting it for free, as in FREE. And Sonia says it's really very good information. Yeah, I think so. I think it's very good. Anthony says, I'm happy we men don't get menopause. Martha McIntyre says she's watching and absorbing everything. Awesome information. Thank you. Anthony says, is he in trouble for eating rice nearly twice a day? Yep, you're
yes,
in trouble.
yes.
Yes,
I do
Anthony
that.
is enjoying reductive visit.
I I somebody.
That's what I said, Samuel. I said some people eat, they can't move, they just sit there. They just sit there. So Baton Kula said, Abby, please tell Liberians how to eat a balanced diet using the fruits, vegetables, carbohydrates, and proteins right there in Liberia. Yeah, yeah. I think Baton Kula is right, because my doctor, who is Pakistani, was saying to me that what they are seeing now is that there are a lot of diseases or illnesses that used to be only for developed countries like the West, that's now in Africa or in developing countries, because either the man and the woman, they work, so they both work, so they eat a lot of fast food, or they eat a lot of processed foods, and so they're eating a lot of high sugar content. They're not eating the natural foods that they used to eat. So there are a lot of illnesses that they are getting now. Yeah.
That
So,
is
so
that is that is true. Even there, and also when they when Liberians come over here or the people from other developing nations come over here, we kind of adapt that same kind of lifestyle. But even there, just the simple example when you watch Nigerian movies, you see like the really rich people. African movie and Nigerian movies, you see the really rich people. You never see water on the table anymore. You see like drinks, you see artificial
yes,
drinks, and which is what we do when you start getting money and you start living okay, you start eating, which is supposed to be rich people, queer people food, and all that is not healthy. But as you get older, as you get richer, you get to the point where you can afford those things. You start saying, oh, I was poor, I never used to eat that, but now I'm rich, I'm going to eat that. And then stop walking different places. I had a neighbor who, when they started making some money, they had a store across the street back home. They literally used to get in the car and drive across the street. Now think about it, it's like, okay, then they have money too, so they were able to eat okay. So all of that, when you're not walking around, when you're not sitting outside and you're not eating the kind of food, like you get up in the morning, you eat your rice, you eat your, you eat Lebanese bread, and you drink your Ovaltine, and you go and you walk everywhere. We walked everywhere, but as you start getting richer and you come to America, you're eating fast, there's stress, you're eating fast food, you're eating a lot of sugary content, you're microwaving everything, you're not eating, and who has time to like be cooking from scratch anyways in America? So that's the most important thing. When you recognize that, okay, I'm eating these things and these things are not healthy for me, let me try to substitute it. Even if I'm going to eat a burger, when I go to McDonald's, I would tell my friend, he said I'm too cheap, that's why I do it. But I get like the dollar menu. I get it from the dollar menu because I know very well that burger is very small. I'm not going to get the Big Mac. If I go to BK, I'm not going to get the big, no, I'm getting the little one, and I get a dollar, and I get their fries. You can have apple fries, which is fruit. And I have little dollar menus. I think it's like 115 now. Those people raise the price. Anyways, so, and I think that, and I get a small cup of juice. If I have to drink juice, I get a small cup of juice, and that's it. Because then I know I'm setting myself up not to eat that much. So it has to be intentional. You have to say, this
Yeah.
is where I am. My doctor said I'm not doing well with my eating. My doctor said I'm not doing this, or I know I'm not doing well. I have this in my family. So I need to be able to like prevent this as much as possible or delay as much as possible. I tell people that just because your family member has this doesn't mean you have to have it, but you also working against those genes. You can't change your genes, but you can change your lifestyle and kind of work around it to keep yourself healthy.
Yeah, eat. I mean, back home, people they're supposed to eat a lot of fish because meat clog the arteries. And even when I go to get something at Wendy's or McDonald's, and it's buy one get one free, and I say no, I just want one, and he said it's buy one get one free, and I say I just want one, and even
Because
the drinks, the small is so large,
yes,
and yeah, and then you feel that you must finish it because you pay for it,
because yes, you pay for
so
it.
all of these things, it's really, I mean Kentucky Fried Chicken, one of the things is moving into South Africa, right? And they love Kentucky Fried Chicken. And I'm like, what? And every time we go, I will say, I want to go to Nando's, right? Nando's is like Sam's barbecue, right? Barbecue, like dinosaur barbecue. And they say, no, 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 sister, let's go to Kentucky Fried Chicken. It's always funny when I hear that. So Samuel Sharper said, how about using a blue light filter glasses? I think that for the blues for the
The
screen.
computers,
Batam
yeah.
Kula say people in Liberia need this type of information. Our people get no counseling or education from their providers back home. Oh, and one thing,
And most people didn't have
Clarence,
providers to go to in the first place anyway. So
so do you have any data on prostate cancer or prostate disease in Liberia right now? Can you share some light on prostate health for the audience? I think you did, but I think
you
she
did,
came in late. Maybe you can
yeah.
just say a little
You
bit
can watch. You
about
can
it
watch the
before.
video again and
Yeah, you
see.
can watch the beginning, Clarence. In the beginning, they talk about Abby talked about it. So Jefferson wants to know about high blood pressure, and one thing I would say, Abby, before you start, my doctor, we will sit down. He will say, "Tell me what's happening in your life," right? And I would tell him he's a really nice doctor. And then he said, every time you have a grant report due, your pressure goes up, and so and so. So he told me to buy a machine, and I bought a high blood pressure machine, $40. I take it in the morning and I take it at night because he said, I can give you high blood pressure medication. And I said, please don't. So now I take my blood pressure and then I go to the portal and I send it to him. So if you can do these things, and sometimes when you feel a little pressure, you just take a walk, and things like that. But that's just me. Let's hear from the expert. Abby, how about blood pressure?
When you say you feel a little pressure to take a walk, if you're feeling the pressure to where you're feeling symptoms, severe headaches and things like that, then you need to go to the doctors. You need to go to the emergency room. Like we tell people, if you have any chest pain, severe headache, um, you need to call 911 and go to the hospital because that means the pressure is too high to where it's not being controlled. But you want to be one regular blood pressure right now, and they say 120 over 80. Okay,
Yeah.
so that would be your normal. And most people when they come with, they also call white coat hypertension. When you come to the doctor's office, your blood pressure is like really high because you're already anxious. So we usually, I don't start people on blood pressure medication. We start looking at it, it's 120 or 80. Okay, so when you're higher than that, I tell you come back in 2 weeks, we'll check it again. Come back in a month, we'll check it again. And we document it. So we start looking at the trends. When we see the trends, we look at what's going on in your life. We're also looking at your medical history and all that. But if you're still sustaining at that same thing, and also tell you you can take your blood pressure at home early in the morning first, send it to us, and keep a record of it over a week and send it to us. So we're looking at what we have in the office and what you're doing at home. When we start seeing that the numbers are almost in lining up and they're staying high to after a certain point, you have to be starting on medication. And of course, high blood pressure too. Also, you can work your way from high blood pressure. So it's like diabetes, type 2 diabetes, type 1 diabetes. You can't do anything about it. You're diabetic forever. Um, but high blood pressure you can work your way, and that goes back to eating healthy. So when the blood pressure starts getting higher and we start looking at 130 over 80, 130 over 90, 140 over 90, that's when we start saying, okay, there's something else that's going on. Yeah, we'll make sure that we do your blood work, making sure your kidney's fine, because sometimes something going on in your kidneys, your cholesterol level, all of that leads to your blood pressure. So but when you start having headaches and dizziness and things like that, that's when we start telling you there's something going on. We have to control your blood pressure. And it doesn't, like, once again, I tell people medicine is not, people look at medicine and like, oh my goodness, oh, when I go to the doctor's office, they just want to put me on medicine. When they do this, they want to do, no, 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 no. We've, at that point, we've already talked to you. But if the blood pressure is really high when you come to the office, usually when it's like really, really high, we tell them, no, no, you have to start in the blood pressure medicine, and then later on we'll take it, come back next week, come back in 2 weeks, and we'll go on from there. And then if we have to decrease it, we have to send you to the cardiologist. If we see any other reasons with EKG and we see something else that's going on besides the blood pressure, then we can go from there. But medication doesn't necessarily mean that you failed, or we just trying to give you medicine. We have to treat the blood pressure to make sure you don't have a stroke or have a heart attack. Those are the major complications from having really high blood pressure, and eventually it leads to kidney failures, and it also can mess with your eyes and all, because it goes after the smaller blood vessels, and then it goes after the larger blood vessels, which would be your heart and your you could have a heart attack or stroke. So it has to be controlled, and if your body can control it from diet and exercise and lifestyle change, then we have to put you on medication.
Okay, so Jefferson say, I mean, when it is in the family gene, but I guess the treatment is the same, Jefferson. Yeah. So,
I
so,
tell
so
people,
I,
if it's in your, that it's part of your medical history. It's part of your, like, when we see you in the office, we do your history and physical. We also ask you with your family history. Your family history is a lot, but that's part of your DNA. So you're working with your DNA. So you have that in your system. That doesn't mean you cannot work around it to delay it or to control it as much as possible. Because even if you have high blood pressure and it's being controlled by medication or diet change and all, you can do that. There's just go online. It's called Dash Diet, dietary approach to stopping hypertension. You can see all the different diets. You can see the different food underneath there that you can eat to control your blood pressure. And if your blood pressure high, if it gets too uncontrolled, even if you come to the office for the first time, if it's too high, we send you directly to the emergency room, because God forbid you could go home and have a stroke or a heart attack, and then what? It's not a shame that they put you on medication. It's just your body. You do your best you can, but eventually you're gonna have to start medication.
yeah. Okay, so let's come to the teeth grinding. There are people who grind their teeth. When they're sleeping, they grind their teeth. When they're awake, they grind their teeth. So talk a little bit about teeth, about teeth health, and then about these different disorders that concerns with the teeth.
Well, you're supposed to see your dentist twice a year, because you're supposed to have your cleaning. And when you see your dentist is looking at your gum health also. So they're making sure that your teeth are aligned well, it's not impacted. You don't have, also, if you have bad breath, it could be the fact that something in the back of your throat. They look at your tongue to make sure you don't have any tongue cancer as well. And then when they do your cleaning, they do the X-ray to make sure those who have like the grinded teeth, they have a guard that dentist can put a guard in your dentist can put the guard in your mouth to keep you from grinding your teeth, because you grind your teeth after a while, that kind of misalign everything, and that can cause problems. It can also cause a headache. And also to look for gingivitis, the inflammation of your gums. Anything that's affecting your gum, your dental health, also has a direct impact correlation with your heart health. Some people have had a heart attack from having like gingivitis or bad gum health for the longest time. So it's important that you follow up with your dentist every every year, every 6 months. And then also they do your X-ray every year. So with dentistry, that's like a particular specialty. So we just kind of skim through it, and we tell our patients, make sure you go into your dentist every year, and then look at your tongue too. They'll look at your throat and make sure there's no anything cancerous, because when you're having tongue cancer, you wouldn't know. You see the discoloration or something else is going on. They kind of look there, they hold your tongue out and look on the side to make sure everything is going on. And then when you come to the office too, we look in your mouth, we look in your nose, and looking at, we see something there, we may say, I suggest you follow up with your dentist to get more definitive testing to go on there to make sure that you're going to be okay, so you don't affect your heart health. But with the grinding of the teeth and all, they have guard that they can put in your mouth. You can wear at night so you don't grind your teeth that much. And there are so many other different things that dentists do that we don't go too much into as primary care, but we just tell you to follow up with them. And then they update us on when they send you to them. They update us on the diagnosis and all.
Yeah. Barton Kula is answering. Say, first, okay, he talked about it. He's trying to explain to her about it. Why dentists keep referring people over and over, like from general dentists to periodontics to endodontics, and they keep charging you for not doing nothing but refer.
Because regular dentists can do the regular dentists they have what happens like, they do up to the scope of practice. We always talk about working within your scope of practice, and there's certain things if you need like dental surgery things like that, they have to send you to the orthodontist and periodontist,
Yep.
and for braces those other dentists take care of it. So they have everybody has to practice within the scope of practice, and then they send you to a specialist that is specialized in doing those things. So if they don't, and in Liberia we have like general practitioners for everything, but you need specialists who are trained to do things more than what this other person can do. We work in collaboration. They send us the notes, the consultation notes and everything. But yes, we send you out to different people. Either with your heart, let's say I would take care of your blood pressure for high blood pressure after a while. But if I see that I've put you on 2 or 3 different medications and it's not being controlled and you start having symptoms, I would tell you, okay, now I'm going to refer you to the cardiologist to carry on from there. So there's a reason why we have specialists.
Yeah, thank you, Abby. But I know that there are people at home who are watching this. So let's do this. Let's talk about. Let's just
I think they're
walk
talking
through.
1 second. I think they're talking to us about the time there.
Yeah, yeah. Okay. So this is the last thing.
Okay.
Okay. So before we go, let's talk about breakfast, lunch, and dinner. Let's say I'm I'm a normal person in Liberia. I don't want to get diabetes. I don't want to get high blood pressure. So I get up in the morning. I get up in the morning. I want to have breakfast. What is the healthiest breakfast I can eat?
Um, bread, but the oatmeal. Oatmeal is very good. It's
Oh
very
yes, yes.
oatmeal. You want to eat oatmeal, you can eat your fruit. We had mango. Oh my God, back when we used to eat all this fruit and ran around and
Quaker
did everything, we were
oats.
healthy,
Quaker oats. Quaker
And
oats is the
yes,
best.
yes. So it's like you eat your oatmeal, anything with oats in it. You can do some cream of wheat and all that too, but nothing too heavy. You drink your Ovaltine or you drink your tea. If you drink coffee, maybe 1 cup of coffee a day. Don't put too much cream in there. Don't put too much sugar in there. Some people say I do like Splenda and things like that. I don't like artificial sweeteners because they also come with risk too. So if you can put some regular
Oh,
natural
that's what I
sugar,
do. I drink a lot of zero sugar creamer in my coffee because I drink about 5 cups a day. So
oh
maybe I should stop.
yeah, maybe you just 5 cups of coffee. Whoa, that's a lot of. Is it decaf?
No.
Oh, oh, Miss Jackie, you gotta cut back
Okay. So
because
so 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 tea in the morning and maybe fruit,
yes, you want to
Quaker
make sure you're eating
oats,
fruit. Yes, cereal.
Quaker
If you
oats
can have cereal,
cereal,
I've
but not
gotten
the
the
packaged
same
cereal. We don't want no cornflakes. It has a lot of sugar in
cornflakes with
cornflakes.
no sugar. They have cornflakes. They have unsweetened cornflakes. Yeah, so
Okay.
yeah,
Okay.
cornflakes, just the cornflakes, plain cornflakes. Some people like a little bit of sugar. You just put like a tiny bit in there if you have to, because you want a person to eat healthy. You can take everything away from them. So you put the
Yeah.
cornflakes in there, your tea, drink some water. Most of during the day, you drink water all through the day. If you're gonna eat, some people eat rice for lunch. Eat a little bit of
Okay. So lunch
rice.
now. Lunch.
Yeah, for lunch. You're talking about back home now. Jeez, I guess a sandwich. You can eat a sandwich and make sure you still eat fruit, because you always want to make sure you have that fruit with you. If you're gonna have Jello or something for dessert, like a nice little. Don't take like a big piece of rice bread. It's like a little bit of rice bread. If you're gonna eat cake, little bit. Then for dinner, you eat your bowl of rice,
But
little
before eight
bit.
o'clock,
Still eat
right?
fruit. Always want to make sure you eat your fruit. Yes.
But before 8 o'clock, you don't want to eat and just lie down. You want to
No,
eat and walk
no, no.
around and things
I
like
used
that.
for me, what I do, I eat Cheerios, non-sweetened Cheerios, or I probably just eat a fruit. I eat an apple and drink my tea. And then, if I'm sitting up, because I usually sit up and late reading patients' charts and all that, getting ready for the next day. And I do that. And when I come home in the daytime, when I leave work, I go for my walk. Right now it's getting cold, so I have to go back to the gym and do that 30
Yeah.
minutes a day, 30 minutes a day. 3 days a week or more, heavy exercise and anything that gets your body sweating and moving your heart rate. Make sure you check with your doctor first before you commence any exercise, and going from there, and just do the best you can. But I think we strayed away from other stuff, so I guess we'll do that in the third series. But going back, I guess we have to do our closing statement now because
Well,
it's
well,
already.
let us. But oranges, I hear that oranges can spike your blood pressure. Is that true? Or
Well,
orange juice?
orange juice, yeah. But if you have kidney, so after you have kidney disease, orange depends on the orange juice. Though, if it's like just natural orange juice, yeah. If you're taking the orange like directly from the thing, don't do too much of it, because even fruits we have, got a lot of the sucrose in there that can also affect your blood pressure, blood sugar. So don't do all of that and do it every day. I would say eat an apple here and there, eat some pears, avocado. You can have a plum here and there, but anything that's too sweetened, the sweetened fruits, yes, they have the sucrose in there that can also increase your blood sugar.
Okay,
And if
thank
you
you
take
so much,
medicine, take
Abby.
it. If you take medicine, take it the way you're supposed to take it. I tell people every time, take the medications that it is prescribed. Some people watch TV and they say, "Oh my God, I heard this on the news and I stopped taking this." People literally come to me the next day. "Oh, I stopped taking my medicine because I heard this on the news. They said this can cause." No, 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 no. Even the people with the studies, that the news will give you the studies, but the news doesn't go into details on or what else you're supposed to do. But they always tell you, check with your doctor before changing any medical regimen. So you want to make sure that you come to the office and say, "Yes, I know they said that on the news, but your situation is different. Okay, I'm looking
Yeah.
at your blood test. I'm looking at this. I'm looking at that." We look at the risk and benefit. If it benefits you more, we'll keep you on the medicine. If it doesn't and the side effects are worse than the benefits, we'll take you off. And some people, unfortunately, they have to be on certain medications. They have to. There's no other way around it. So that's what keeps them healthy. But then they listen to the friends. "Oh, my doctor said no, 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 no. You're different. You're different." Okay, that's why I
Yeah.
said, look, talk to your doctor. Don't sit there because my friend said this or this TV said this or this person said that. No, that's not how it works.
Thank you so much, Abby. Of course, we're going to have you back because this is like, as Anthony said, free advice. FREE, free. I've learned so much, and I know that others who are asking questions have learned as well. So, what are some of the last comments you will leave with us, health wise?
I say go ahead and see your doctor every year like you're supposed to. They will give you a routine test when they give you that lab slip. Some people have on the lab right in the doctor's office to make sure you get your lab work done, because that's how we see everything, and then govern your care from there. Making sure that you have an advance directive, meaning it's also called living will, that if anything should happen to you and you can't make decisions on your own behalf, you have somebody who's appointed, designated to make decisions, and you go into the hospital to make decisions for you. Don't just say, if you're married, it's going to be quickly your spouse. But if you have children and you have living with your girlfriend and things like that, your girlfriend's not going to be making that decision. Your children, your adult children will be making that decision for you, or your parents will be making that decision. So make sure you have that. As people get older, we start talking about regular living will. We start talking about regular will. We start talking about end of life care. What are you going to do as you get older and you can't take care of yourself anymore? Are you going to be living with your children? Are you making sure you're saving enough to be able to live on your own? If you take care of any child with special needs as you get older and that child lives with you, you want to start making decisions on who's going to take care of the child when I'm no longer around to take care of this child, or I'm not well enough to do that. Um, but like I said, we're going to talk about this more, so I'm just going over, and just make sure when your doctor tells you something, and if you have any issues with it, you'll be like, you know what, I don't want to do that. Just talk to your doctor. Every doctor or your nurse practitioner or your PA, they will sit there and will listen to you. And when there's so many options, so don't feel that you just come into us and we're just telling you do this, and do that. We listen to you. We discuss it with you and all that, and we agree on a plan on what you can do to make it better. So make sure whatever it is you're doing, take your medicine like a temple. Take your medicine like it's prescribed. Do not skip. Do not change. Do not. And when before you run out, make sure you call in your doctor's office at least 2 weeks before you run out to make sure that it's in the refill. And don't say, "Oh, ran out. I couldn't get it." So make sure you're taking that. Drink a lot of water. Eat healthy. Cut back on your starch. Cut back on your sugary drinks. Exercise 30 minutes a day, 3 times a week or more. Stay healthy. Watch your stress. Sleep well, get enough sleep, watch your stress. Don't let people on social media bother you too much, because that's our life now. So we don't go out and just talk to our neighbors. Social media is our background now, our backyard. So making sure that don't internalize too many different things. Don't watch the news too much to internalize. I'm one of those people who internalize things. So don't internalize too many stressful things that are on TV. Doesn't mean you shouldn't be informed, but don't internalize it and don't watch it too much. Watch what who you're giving audience to. What's important, watch who you're giving audience to, because there's some people out there who are just really toxic. So
Yes.
I hope what I said today have helped one person, and we'll go back, we'll talk more about it next time when I come back on. And I think that's it for now. Miss Jackie, any other questions, or we're just finishing up now?
No, thank you so much, Abby. I hope next time we can have more time, and after that we can maybe have a show on women's health. Talking about. I mean, I'm sure some girls didn't know that wearing leggings would give them problems. I mean, I read it. I was like, and you're right. I mean, with the last administration, I just gave my TV away. I just could not take it anymore. So be careful when you put your television on. It's like inviting somebody into your house.
Hmm.
So be careful with your stress. Want to say thank you. Want to say thank you to you for your useful advice, and we hope you will come back. And then those of you who are asking questions, is Abby Tyler Healthy Living. You can go there, right, Abby? And they can
Abby Tyler's
find
Healthy Living
information.
page is the public page. You don't have to be a member,
Yes,
just click and follow. The Abby Tyler's Healthy Living group is the one that's a private group, but you can also join that. But the Healthy Living page, you can just go over and then just hit and follow and
yeah.
just watch all the other videos that I've already put up so far.
Watch the videos and keep healthy. So we want to say thank you.
Thank you.
We want to say mask up, keep healthy, and remember we are all Liberians. Thank you. Good night.
Good night, everybody. Thanks for watching.
We are Labira. Labira is our home. Labira people. Labira, Labira, Labira.